Yeah. So as we look forward to hopefully returning to work, how are you thinking about managing situations or managing the situation as a whole to make sure that people are not apprehensive or that they feel comfortable coming back to work? What are some of the things that you're already doing or are thinking of doing to help that situation?
Well, I can tell you there's not only just at WBC, but there are several sector-based working groups put together to try and work through, what does that look like? How do you keep people comfortable and safe and making sure that they feel safe? And there'll be a lot of things in play, different kinds of workstations. I learned the other day that there's technology that where you have elevator buttons that self-sanitize. Who knew? But I do think you'll be saying, yeah, I know. Like,
No idea.
I wish we could have used those before this pandemic. But I think, every workspace is going to be different. But I think one of the things we saw even in the immediate aftermath of the shutdown, one of the things when I was talking to employers that I saw that I knew but really came out was I had so many employers whose business had just been shut down. Small, local neighborhood businesses don't have a lot of resources. Their first and primary concern was, what are we going to do for my employees? I'm worried about my employees. Are they going to have access? And I think that is true for so many companies. And I know that sounds a little Pollyannish. People are like, oh, nobody cares about the workers. But that's just not been my experience, particularly in entrepreneurial companies. And so I think companies are going to step up to make sure that their work environments are safe and that their employees feel comfortable. That's going to be a little bit of a challenge because, of course, every employee is different. But I think you're going to see people being very creative and innovative. And I think you're going to start seeing technologies that are going to help support that.
Thank you for that view. And we're at a point where I can turn to the audience, and there's a question from the audience that I think dovetails nicely into this. And it's from Curtis Powell. He says, what fundamental changes in employee, customer, and other stakeholder behaviors do you think will persist for the long term after the immediate threat is over?
Well, I mean, I think, look, at least for the immediate future, you're still going to see social distancing when people are interacting. Hopefully, you're going to have to. I think people are going to be way more conscious about, personal hygiene and cleanliness in their workspaces. And I think you'll see that. And hopefully, what I'd like to see, and unfortunately we've seen a lot of it, but we've also seen a lot of the negative. You're going to people think a little bit more about community and sense of community, how what you do impacts others. We've seen a whole lot of that. We've also seen, some insensitivity to that. But I think that core idea that what you do can have a broader impact is going to stick with us for a while.
I've signed every email for the past couple of months, stay healthy, Mark. I end every email, stay healthy. And I've said on every occasion, my number one priority to each employee of SMS is you personally, stay healthy. If you are healthy, you can help keep your family healthy. If you and your family are healthy, you will keep SMS healthy. Because if you're not healthy, you won't do good to your family and you won't do good to your employer. And what concerns me the most, it's not about what's going to happen in our offices. Angie, Sam, myself, Maria, we all have different offices. But what happens when people leave their homes? They need to get to an office building. And then depending on the building, they have to make their way from the front door through a lobby, and then into the office, or through a lobby, into a series of elevator banks, and then into an office. So it's much more than just what the companies are going to do. This gets into the public, private, civic. This is something that we all have to work on. And I think people will be far more aware of health and well-being in the future than they ever have been in the past.